Let's talk about those medications. Are there good medications out there that can really help you with indigestion, with heartburn, with GERD, with IBS, all those things?
Sure. There are, to me, there are kind of 3 tiers of medications. The first one are simple antacids like Mylanta, Rolaids, Tums, that simply sort of absorb some of the acid and neutralize it. Then there are over-the-counter medications like Pepcid, which decrease acid production in the stomach for a short period of time. And then there are the more potent medications like Nexium or Protonix or Prevacid, Capodex. There are about 7 or 8 different trade names for those medications that we call proton pump inhibitors. And those medications have been around for many years, and they're very potent at stopping acid production in the stomach. That doesn't stop reflux, but it makes what's refluxed less acid. And in many patients, that's all that's needed to alleviate the symptoms of GERD. And in many patients who have indigestion that's not really GERD, that's really all that's needed. So there are a slew of different medications. I would say people that have ongoing symptoms on a daily basis tend to end up more often on the proton pump inhibitors.
Mm-hmm. What about side effects from those medications?
For the most part, they're very safe drugs, Kathy. They've been around for many years. There are some recent reports of an increased incidence of osteoporosis or hip fractures in patients who have been taking high doses of proton pump inhibitors for a number of years. Now, if you look at the FDA label, it says don't take for more than 6 weeks. There's actually pretty good data that it's safe to take long term, but I think people that have been taking it for more than 5 years certainly ought to sit down with their physician and say, is this something that I really ought to take? Maybe, especially if they're at high risk for osteoporosis, maybe screened for that.
Mm-hmm. And does it really, Rachel, would you say the very first thing that you need to do is go talk to your doctor about an eating plan, an exercise plan? Try that first before you ever turn to a medication?
Well, and I think primary care physician can help both with the lifestyle as well as medication if they think that if medication can be avoided. And in some cases it can. Going back to that question, he mentioned that he or she was 20 pounds overweight. You know, making those small healthy lifestyle changes to lose weight would be one thing. And something that could be done right today to help would be eating smaller portions, because that's been shown to decrease the symptoms for both GERD and IBS.
Okay. Here's another one for you guys. Why is it that more and more children are diagnosed with or are taking medication for acid reflux GERD? Children.
Yeah, I don't think we really know for sure. It absolutely is being diagnosed more often. There are certain premature babies are much more likely to have GERD, and that may persist. I think there's also an increased awareness of those symptoms, and so it's getting diagnosed earlier in that respect. But it is and also many kids are a little bit heavier than they used to be. So I think those are 3 factors, but I think it goes beyond that, and honestly, we don't know, Kathy, why that is.
Mm-hmm. When you say premature babies, is that because things haven't developed correctly?
Correct.
Yeah, okay.
Correct. Yeah.
So they run into that by no fault of their own, obviously. But do you feel like we just do such a disservice by allowing our kids to get heavy?
Absolutely. Absolutely. I think when I look at, I'm a surgeon that also does some weight loss surgery, and so I see the worst of the worst in terms of weight problems. But when I look globally at our society, I think the issues that we're having with weight and weight control are probably going to be huge in terms of our costs down the road, in terms of medical costs, and just people not being healthy.
So, Rachel, how do you get through to an adult to say, this has got to stop? I mean, I have heard of so many people who say, oh, I took her to the doctor. The pediatrician says she's right where she needs to be. She's in the right percentile. And you look at the child and you're like, that can't be. Are they kidding themselves? Do they just not want to admit it? And how do you get that through to a parent that they're hurting their child and they're hurting them potentially for life?
I think there is definitely a disconnect between parents and how they view their children and whether or not their child is overweight. A lot of times there is a little bit of denial there, if you will. But usually when they do go for their annual checkup to the physician, do their physical before school starts, I think a lot of times physicians are identifying kids as being overweight and saying, hey, you might need to make some lifestyle changes. And some, again, the same easy steps you can do as a parent, you can do as a child, and you can do together as a family. Go play in the park together on, you know, Saturday afternoon. Get out and be active together. Go play games. Go to the park and play basketball, things like that.
It sounds so simple, but I think what happens is people want a quick fix. And if they're 20, 30, 40 pounds overweight, they think, oh, it's never going to happen that way. I need to just, you know, get on this crash diet. They get on the crash diet, and then they go right back to what they were doing. So it's a kind of a vicious cycle. Here's Blondie. I take over-the-counter antacids nearly every day to control heartburn caused by prescription steroids. Ugh. How long is it safe to use Tums, Mylanta, etc. on a regular basis?
I think that's safe to use on a regular basis. There's no evidence that it causes any problem. Part of the issue, though, is that you may have reflux that may have caused some damage to the esophagus. For the most part, I suggest to people that have had reflux for more than 10 years that they talk to their physician about possibly an upper endoscopy. An upper endoscopy is just putting a lighted scope down and examining the esophagus, so it's kind of a physical exam of the inside of the esophagus to make sure there aren't any serious changes.
So then what could they do if there were?
If there are serious changes, it depends on the degree, but if there's, sometimes we find a condition called Barrett's esophagus, Kathy, which is where part of the lower esophagus has been eroded, and the cells that replace it look more like stomach lining cells. And the problem is that when they kind of come up there, they have an increased potential for turning cancerous over time. So those patients who have Barrett's esophagus are put on a close surveillance program, so they may get yearly or every 3-year endoscopies. And typically they'll take prescription medication or consider surgery as an option to control the reflux and hopefully at least decrease the risk of that progressing onto cancer.
I think what people have to realize is this isn't just the guy who tends to burp a lot.
Correct.
These are people who have very serious problems as a result of this that, as you said, I mean, some can lead to cancer.
Correct.
Something you need to take care of. Amanda wants to know. No, we'll go to Jim first. Sorry, Jim. Because of my condition, I feel like there are certain foods that I have to completely ban from my diet. Is that the only way to deal?
Jim, it sounds to me like you're talking about that you have acid reflux disease. So if you're on prescription medication and you still find that certain foods are irritating, or you find that you can't go to sleep at night after eating a later meal, and maybe you're in business where you entertain and stuff like that, then there are surgical options to control reflux. And typically what those involve is just reconstructing the valve at the lower end of the esophagus so that it decreases the amount of stomach juice that comes back up.
Do you want to take a look at the one that you do?
Sure.
You are known for a specific surgery. Can you please explain
Sure.
that, and we'll take a look at it?
Absolutely, yeah. We'll show a video here. Traditionally, surgery to control reflux has been done through incisions made in the abdomen. And what's done is really kind of folding part of the stomach up around the esophagus, kind of dunking the lower esophagus in. This device, which is a surgical procedure, this device permits us to do a surgical procedure that we do from inside the stomach, so without any incisions. And what it consists of is a way to pull down this lip of the valve. And it says there the Z line. So we pull down that lip of the valve, and then we place some polypropylene fasteners in between the inside and the outside of what we've pulled together, so between the esophagus and the stomach, and that then creates a flap valve mechanism. And that's actually the way our body natively is designed, to kind of create a one-way valve so that food can go through, but then it won't reflux back up on us. So this recreates or strengthens that valve in patients that have a weakened valve.
And that should stop the problem entirely?
Correct.
It's about a 2-hour operation, 1 to 2 hours?
Yeah, it's about 1 to 2 hours. It's done under a general anesthetic, but it's a very fast recovery. Most patients take pain pills for maybe a day or two and can go back to sort of normal, non-vigorous activities within a few days.
Any risks with this?
There are some small risks of bleeding or infection, but they're overall less than the surgical procedure that we have done in the past.
And the idea that it's incisionless, I know really nowadays minimally invasive surgery seems to be the catchphrase. Everybody wants to go in and be able to go back to normal routine pretty quickly and without cutting That helps,
yes,
right?
Absolutely.
Okay. Well, there's a very interesting one, and one that obviously people can contact you to find out more
Sure.
about. I wanted to get back to that one question. Is that the only way to deal? Rachel, tell me what you think about all of these things that are out there, the probiotics. There's that one. I eat one every day. I will tell you that. This Activia, and I swear by it. I really do feel like it helps me. Like I don't have issues. I can eat whatever I want, and just, as you said, in moderation and all that, and not overdo the fatty stuff and all that. But I feel better.
Yeah.
No? Is that all in my mind?
So there isn't any hard science, no research to say probiotics help things like IBS or GERD. In fact, the evidence is split on either side. And, you know, for some people it might help, and for other people it may actually irritate their symptoms and make things worse. So if it's something that works for you and you believe in it, you know, that's fine. Although for some people it's just going to mean that you're spending more money, and possibly same thing if you take all these extra vitamins that you don't necessarily, your body can't use,
right.
You're going to be excreting them, and it just becomes expensive on the back end.
Exactly.
So to speak.
Heard that one before. But, I mean, eating a yogurt a day, I mean, that's not going to hurt you.
No.
And if it helps you, or if you think it's helping you, it makes sense to me. No?
So there's two sides of that. The active cultures in yogurt can, in fact, be beneficial. On the other side, if dairy causes some issues, then that's not such a good thing to have.
All right. One more question here. I experienced acid reflux during my pregnancy. This is Amanda. Should I be concerned? Is this bad for the baby?
First off, it's not bad for the baby. And most of the time after pregnancy, the acid reflux will go away. During pregnancy, you've got very high pressures inside your abdomen because you've got this big baby taking up some space. And so it's not uncommon for women to have acid reflux during pregnancy that'll go away afterwards.
Plus, you want to eat more.
Absolutely.
At least I found that. Was
Yeah.
that not a true thing? Oh, well. Always found that was one of those. What other things, if there was one thing that each of you could say to people who have experienced this, who worry about it, what would you tell them to do? So let's start with you, Rachel.
So I think, of course, first of all, you should go to your primary care physician and discuss the symptoms and see what needs to happen next. Other than that, I think there are small, healthy lifestyle changes that you can engage in that may help diminish symptoms. And even for something like IBS, it's really highly linked with depression and anxiety. So making small, healthy lifestyle changes like moving more, going out and enjoying this beautiful fall day we have would be a great thing because it helps both sides. Movement helps digestive tract, but also can help your mental state as well.
So does depression cause it, or does it cause depression?
That's the chicken and the egg, and we don't know which one's the cause.
All right. Dr. Bell?
Yeah. I think really the thing that I would say is that there's a lot that can be done in terms of lifestyle modification, weight loss, and so forth to help treat a lot of symptoms of indigestion. And oftentimes as a society we come and we say, I've got a little indigestion, give me a pill to take care of it, instead of looking at what other things we can do to help better control those just by eating properly and so forth. On the other hand, I see patients who for many years have been trying all that stuff and it hasn't worked, because there are some patients that genuinely have a damaged valve and no medication or lifestyle change is going to take care of that. So don't be afraid to say to your doctor, I'm really not getting adequate relief from the lifestyle changes and the medication. What are my other options? So don't just keep on ostriching a symptom that's really there.
Sure. Exhaust all the options,
Yeah.
I think, and then go from there. And if you have to go in for surgery, go in for it. You'll be a better person for it, hopefully, on the other end out, huh? Great. All right. Well, thank you very much. We appreciate having you both here. That's all the time we have. Thanks for taking part in our Talk to the Doc chat. We were pleased to have Rachel Lindstrom here from the Center for Human Nutrition. Also, thanks to Dr. Reginald Bell from the Swedish Medical Center. If you missed any of this chat, it will be posted in its entirety in an hour on CBS4Denver.com. Watch CBS4Denver.com for information on future chats. Have a great day.